All right, good morning, everyone. Thank you for joining us. This morning, we are going to be talking about over-the-counter medication use. Thank you to Steph and Michelle for joining us. Steph Busick and Michelle O'Brien are both from McLaren St. Luke's, and they are pharmacists there. So thank you so much for providing this program for us today.
Absolutely. Thank you for having us. So I think I have the ability to screen. Let's see. It says the screen share has been disabled.
I just went ahead and enabled it, so you should be able now.
Perfect. I was having a little trouble with my internet earlier, so let's make sure. All right. Steph, can you tell me if you can see it?
Yep, I can see it just fine.
Okay. All righty. So we're going to talk about over-the-counter or OTC. So if we say OTC, that's what we mean is over-the-counter medications. And again, my name is Michelle O'Brien. I am the pharmacist with the McLaren St. Luke's Family Medicine residency, and Steph is one of my pharmacy residents. So she's about to graduate from the pharmacy residency program here in about 2 months. So after this presentation, you should be able to list general tips to consider when choosing an OTC medication, and then describe the pros and cons of OTC options used to treat allergies, cough and cold, heartburn, and pain. So we decided to go with those. Over-the-counter medications is a huge topic. We could probably come back multiple times to talk about all of the over-the-counter medications, since it is extremely overwhelming when you go to any pharmacy. But we thought that allergies are kind of hitting right now, and cough and cold's always good to review along with heartburn and pain. So just some general tips that we want to make note of is that thing here. If you're experiencing any severe symptoms, of course, always seek medical attention. So you know your body best. If your spidey senses are ringing, and you say that something is not right, that is a good phone call to your physician, or if it's very severe, taking yourself to urgent care or an emergency room. Always read the ingredients on the product label. So as pharmacists, we cannot stress this enough. So there are so many combination products, which we'll get into when we talk about cough and cold, but we really encourage you to always make sure you're looking at those labels, because a lot of the medications can include a bunch of different things. So we want to make sure that you're aware of what you're taking and what you're putting in your body. And then it's always important to follow the instructions. So it'll tell you how many tablets to take or how many milliliters to pour out, and then how often you should be taking your medication. So we want to put a disclaimer on this, that we are not advocating for any, say, one brand of medication or anything like that, but we know that with over-the-counter medications that it's probably easiest to talk in brand names because that's what you see most commonly. So we want to make sure that you're aware. We're not trying to stray you from one area or another, but just for the idea of understanding kind of what class of medications we're talking about, we're going to put some brand names up there. But to be noted that most of the time on the counters of the over-the-counter aisles, right next to a brand name, there's always a generic medication that's usually a lot cheaper, and generics work just as well. But you make the best decision for yourself which you want to pick, but just to know that when we're talking about these medications. So first, we'll talk about seasonal allergies. So I know right now that pollen is super high. Everybody in my household right now is suffering from pollen allergies, constantly rubbing our eyes and sneezing. So we thought we would start with this. Alrighty. So these are probably the most common medications that you're going to see on the pharmacy shelves. So you have your Allegra, Zyrtec, and Claritin. And again, those are just the brand names, but there are the generic options. So these are the least drowsy. They're marketed as non-drowsy. They're generally safe. They're generally well tolerated. So most of the time, if you have just kind of run-of-the-mill seasonal allergies, this is your best bet. And if they are seasonal, you don't have to take it year-round. You can take it when things are flaring up. So these are just really good options. Again, very low side effects that you have to worry about with these, unlike some of the other medication that we'll talk about next. But again, you shouldn't really be drowsy when you take these. But we want to make sure that we watch out for the D products. So we call these the D products because these are advertised with a D, so a decongestant in them. And most of these are available behind the counter though, so you would have to go to the pharmacist to ask for them. But these are different. So these definitely can come with a little bit more side effects, and there are certain types of patients that can't use the D products with the decongestant in them. And we'll talk about those when we talk about cough and cold. But it's important to note that there definitely are two different kinds. So you just have your regular antihistamines, is what we call them, and then you have the ones with the decongestant in them. So I would say not to use these on a regular basis, only maybe if it's very severe and you really are clogged up there, but not on a normal basis. So then what about Benadryl? So Benadryl advertised for allergy. So what are our thoughts on that? Or diphenhydramine is the generic name. So there's plenty of diphenhydramine products out there. So this one, generally not preferred because it can make you very tired. I know that when people take it, within 30 minutes to an hour, they're conked out. So it puts them right to sleep. So this would be not a great option if you have allergies during the day and you need to function during the day. So we kind of try to detract from this one in general. It doesn't really work in the length that are for as long as say like the Claritin or the Allegra would. And then it really can cause some confusion, which could cause some increased risk of falls. So kind of getting a little bit disoriented when you take them. And then it really dries you up. So if anything you think about that really dries you up, so the dry eyes, the constipation, having trouble urinating, dry mouth, everything that would just dry you up, take all that moisture out. So this one is not the best for just your run-of-the-mill seasonal allergies. You definitely want to take one of the other ones on the previous screen. So what about nasal sprays? So this is another option. So if you really have most of your allergy symptoms are in your nose and in your sinuses, these are a really great option. I attest to this. I take Flonase, or the generic version of Flonase, plus Claritin on a daily basis because that's how bad my allergies are. So I really think that these are great options for those nasal type of allergies that you have. So sometimes they can be taken once a day or twice a day, depending on maybe the time of the year and how bad your symptoms are. But it does take about 1 week to see the effects because these are steroids. So these are nasal steroids is what we call them. So it does take some time for your body to kind of build up a response to it. And it does require constant use. So we kind of discourage people from just taking these as needed. We want you to take them kind of on a regular basis because that's the way you're going to get the most benefit for it. So if you're spending the money on a medication, you want to definitely take it on a routine basis to get the most bang for your buck there. And side effects include bleeding and sneezing. So I'll tell my personal story too. In the wintertime when it gets really dry, I have to take this year round because I have other sinus issues, but it definitely, I do get some, when you sneeze or something like that. So bleeding definitely can happen with these. So I just, maybe take it back from twice a day to once a day when that happens. But yeah, so that's something to watch out for. But they're great drugs. They really work. Then cough and cold. So this is a big meaty subject here. So there's lots to think about with cough and cold medications. So treating the most bothersome symptom first. So pretty much in general with the cough and cold medications, it's not a cure. You're not going to get rid of the cold necessarily. You're really just treating symptoms. So what's most bothersome to you? Is it a cough issue? Is it a sore throat? Is it I can't breathe through my nose? Is it my nose is dripping and dripping and dripping? So a lot of times, we're just kind of symptom treatment there. And then beware of the combination products. So we'll talk a little bit about that. That their cough and cold market has expanded to include every combination of every kind of medication to treat your cough and cold symptoms. So typically, what would be in these combination medications? A lot of the times they'll have something for pain. So like an acetaminophen, which is also known as Tylenol, an ibuprofen, which is Advil, or an aspirin, which some of the Alka-Seltzer products contain aspirin. So sometimes these are good, if you do have a sore throat, that would be an area these can work too for fever, to bring the fever down. Next There's the cough component. So some of the medications contain something to help you with the cough. So there's two types of things that we think about, and we'll kind of talk about this later, but there's one called guaifenesin, which is big fancy terms. These are both big fancy long words, but that kind of helps get the congestion up and out. And then there's the dextromethorphan, which keeps you from coughing and coughing and coughing. So they do serve different purposes. And again, I'll talk a little bit more about this when we look at some specific products. You have your nasal congestion. So if you're all congested up in your nasal passages, there's two different types of medications that will open that up and kind of help you drain a little bit. And then if you have a runny nose, a lot of the times that might include this drug called chlorpheniramine, which can make you drowsy too. So caveat on that, but some people tolerate it pretty well. I can pummel through the drowsiness. My husband on the other side, he takes it and conks right out. So it just depends. I take it with a cup of coffee and I feel okay. So it's kind of working through it, because I know for me, a runny nose is sometimes, really hard to work when you're just dripping and dripping and dripping. And in particular, if we're wearing masks, that's pretty hard too. So a lot of the medications pretty much that are over the counter can include a whole combination of a variety of different ones of these. So the big point to make on this is that I advocate a lot for just picking single ingredient medications, because if you don't have a cough and you're taking something that contains that cough suppressant in it, you're just adding another drug that you don't really need. So if you can try to find like the single ingredient ones so that you're really treating just exactly what's going on. Some of the ones have, say, nasal decongestant and something to treat a runny nose. So now you're treating a stuffy nose and a runny nose. And that kind of seems counterintuitive, right? So they've just kind of taken this market and ran with it. And so we want to make sure that you're just kind of treating what you actually have going on. So here's an example of kind of how we call it product line extension. So one brand grabs hold of something and they just keep making more and more and more and more drugs of the same kind. So this one has two exactly different, I should say, one is called Fast Max and one is called Sinus Max. So these are two different products, but they contain the exact same ingredients. So they both contain the same 4 medications. So this is just kind of how they've taken one thing and marketed it and marketed it and marketed it, where we want you to be aware that you could be looking at both of these saying, which one do I want? Well, I have sinus issues, but both of these actually contain the same medications. So that's where reading that label is really, really important to make sure that when you're looking at that. So like, for instance, this one has something for pain and fever. It has your cough suppressant. It has something for nasal congestion, and it helps get the cough out. So it's kind of just like, there's so many things in here that you might not actually need. So I just took a screenshot here to show you what you would look at if you went to the aisles and see all the different products that they have advertising to you. So all of these Advil and Tylenol products, all of these different Alka-Seltzer products that they have. So they just are different combinations of everything. And this could be really overwhelming, right? Because you look at this and you say, well, I don't know, I kind of have a stuffy nose, but which one's going to treat just the stuffy nose and which one's going to have the cough in it? So really, we ask you, if you don't know where to begin, go ask the pharmacist. So they're super, super helpful. They'll come out there, they'll show you what to take, and they'll really kind of pare down to make sure that you're taking the safest medications. Here's another version of it. All of these different Mucinex versions out there, all the different Sudafed versions out there. So again, it's overwhelming for us as pharmacists to have to turf through. Like when I pulled up these manufacturer pages and I was looking at all these and I'm like, oh my gosh, I was like, I don't even know where to begin, and same thing even with my husband, he's a teacher. I keep bringing him into the story, but I try to educate him when he has something and he goes to the pharmacy and he doesn't even know. And I'm like, you're married to a pharmacist. I try to teach you, and it's even hard. So I promise you're not alone if you look at this and you don't know where to begin, because it is extremely overwhelming. So I guess my take home point really is think about which symptoms you're trying to treat, and then seeing if you could ask the pharmacist to try to get down to, 1 or 2 ingredients or 1 or 2 medications in there so that you're taking the safest amount and not taking things that you don't need. So just kind of zeroing in a little bit on cough too, because I want to make this point. So if you have a productive cough, we say to look for something with that guaifenesin in it. So that's the generic name, guaifenesin. And so what this does is it breaks up that mucus in your chest and helps you cough it out. But the big key with this is you got to make sure you drink a lot of fluids, because the fluids are going to help thin that out too. So making sure that you're drinking a lot of fluids and then breaking that up so that you can cough it out, you can get that out. But if you have that little dry kind of hacky cough, and it's really, really bothersome, you can look for that cough suppressant. So the thing that suppresses the cough, that's called dextromethorphan. So this one, I kind of say is a flip of the coin. So if your cough is really, really bothersome and it's impeding what you're doing on a daily basis, like you can't sleep, or if I had a cough right now, I'd have trouble giving this presentation. So if it's really bothersome, you can use the cough suppressant. But the downside of using a cough suppressant is if you're not coughing, you're not getting up that congestion. So you're not working it out of your body. So it's important that you give your body some time to pack it up, essentially, to get it out, right? So we need to get out the what's going on inside of your chest. So I say use this one sparingly. And then if you have a cough that feels like a tickle at the back of your throat, that's usually because you're congested up here and it's draining out the back. So it's tickling your throat in the back. So in order to prevent things from going down, we want to get them out instead. So by doing that, you can use a nasal spray. So this is a different type of nasal spray than the allergy ones, and I'll show you a picture of this moving forward. But this, essentially, you spray it in there and it opens up those nasal passages so you can blow out what you got going on. This is probably my favorite drug when I have some congestion. Opens right up within a minute, and you can just blow out all that gunk. So this is an example. Is that it's called Oxymetalizing. So may experience some burning, stinging, or sneezing when you put it in, but in general, it's pretty well tolerated. But the thing to remember with this one is that not to use for more than 3 days. So if you overuse it, then you can cause worsening of your congestion. So I always try to find kind of what I think the worst part of my cold is, where I have the worst congestion, and then I use it then for 3 days. And so to get all of that out, and then I'm usually on my way to feeling better after that. So I think these are really, really great. So to be noted, again, if you're wondering what this is, so if you ask the pharmacist, you say, no, I need something to open my nasal passages because I have a cold, they'll direct you towards this one. If you tell them, oh, I need something to open my nasal passages because I have allergies, they'll direct you towards that steroid one instead. So it's kind of important to let them know kind of why you're having those symptoms, and they'll point you in the right direction, because there is the two types of nasal sprays. But again, there's also the tablets that work on congestion as well. So that's that Sudafed or pseudoephedrine. And again, that's behind the counter. So you do need to get that one behind the counter. But those can be not great for patients who have high blood pressure, heart disease, or an irregular heartbeat. So pretty much if you have some cardiac issues, it would be best to ask your doctor before you would take this one, just to make sure that you're safe, that you're taking it safely. And then there's another option that's called phenylephrine, and that one's not behind the counter. And that's less likely to cause the elevated blood pressure. Still worth asking your physician about starting either one of those oral ones. The nasal sprays are usually pretty safe because they don't really get absorbed. So they just kind of work right where it needs to be. And then if you have a sore throat, of course, a good option, are your, oh my gosh, I'm drawing big cough drops, and then, or chloroseptic spray. Got to get that one in the right spot though. So don't spray that on your tongue, because then it's really weird. That's happened before to me. So it's just important that you spray that in the back. But these are pretty much, again, just symptomatic treatments. Unfortunately, there's not a whole lot for sore throat other than some of those pain medications. Again, but sometimes we would want something like this instead, which definitely we'll talk about pain medications and kind of who can use which ones moving forward. Alrighty, so heartburn. Steph, do you want to take over here? All right, stop the share.
Okay, can you see that okay?
Yep.
Perfect. Alrighty. So thank you so much, Michelle. I'm going to take over talking about heartburn. So that burning sensation you get maybe after eating certain foods, can be pretty common. And we'll talk about some of those over-the-counter options you have to manage that. So just some important things to note. So at the beginning, we talked about, if you're having any severe symptoms for anything, go to your physician. It's not sufficient to just treat with an over-the-counter product. So in this case specifically, if you're having trouble swallowing with your heartburn, nausea, vomiting, diarrhea, black tarry stools, that's a sign that something else might be going on, and you're gonna want to go talk to your provider about it. Other big points with heartburn is that if you've had these symptoms just kind of ongoing for more than 3 months without treatment, might be a time, that you want to go talk to your provider again there, or if it's lasting longer than 2 weeks with treatment. So those are kind of your times to remember. So no more than 2 weeks of these over-the-counter products, or no more than 3 months of just the symptoms without anything. So always be safe, safety first on that front. So the first option we have, I'm sure everyone's familiar with Tums. So this is going to work to kind of just neutralize that stomach acid, help you feel a little bit better. There's also Rolaids you can use. Also, another thing that you might be able to see is just, I have a picture there of the over-the-counter generic option. So if you don't want to pay for the Tums, there's always going to be that other option like Michelle mentioned. Something that's really great about these, what we call them is antacids, they work really quickly. So they work within like 5 minutes, but they also wear off pretty quickly. So they'll usually wear off after about 30 minutes or so. So again, they work very quickly, which is helpful because then you can kind of use it as needed. But knowing that it's not really going to provide that sustained relief is important. Generally well tolerated, but I will say, so something I learned actually from Michelle is that if you take too much of, a lot of them have calcium carbonate in Tums, that over time can cause you to feel kind of bloated and maybe a little bit gassy because of the carbonate component. So again, really reading those labels and following the instructions is super important here. So yep, very good option. Again, very well tolerated for just those kind of infrequent mild symptoms that you have. The second option we have, I'm sure you might have heard of Pepcid before. Other drugs like this are Tagamet, and there used to be Zantac, but it was actually pulled off the market. So focus in on Pepcid here because that's really the one we would recommend for really anyone, and we'll talk about why. So Pepcid again works pretty quickly, within 30 minutes. So let's say you're going to be eating a meal that might not sit well with you. For some people, it's that spicy Mexican food, so good, but might not sit well. So just take it at the beginning of the meal. It'll work within about half an hour, but it lasts longer than our Tums, but it might not last the full day for you. So just keep that in mind as you're consuming certain foods. Again, generally well tolerated. You can use this one as needed. It'll work again pretty quickly after you take it. Some people might experience a slight headache with it, but again, generally well tolerated. Now, Tagamet or cimetidine is the other name for this one. We recommend avoiding this product because it has so many drug interactions, and how are we to know, right? If it's over the counter, you can always ask your pharmacist about it. Does this interact with what I'm taking? But truthfully, I would say just avoid it at all costs if you can. So big red X over Tagamet, don't take it. If you're gonna go with one of these, you'll kind of have to go with Pepcid at this point. So Pepcid is a good option for your heartburn. The third option we have, these are all the same type of medication again. So you might have heard of Prilosec, Nexium, Prevacid. So again, these are all the same type of medication. And I will say they work very, very well. However, take a little bit longer to work. Works for the full day though. So not so much for your as needed symptoms because it's going to take some time to work. So really the best way to take this type of medication is 30 minutes before the first meal of the day on an empty stomach. And you really should be taking this one every day for it to work the best way that it can. But again, you don't want to use it for more than 2 weeks without your provider knowing. Why is that? Well, long-term use of this medication class they've actually seen an increased risk of infection, especially pneumonia too. So that can be pretty important. Increased fracture risk. We know as we age, our bones get less strong, and this might contribute to that. So we want to, not use it long-term if we can avoid it. And then also some different vitamin and mineral deficiencies. So again, very effective, but don't use it long term. Truthfully, I feel like Pepcid is always my go-to. So I would recommend trying Pepcid for heartburn, or if it's not bad, go for some Tums, but definitely do not use this type. So your Prilosec, your Nexium, or your Prevacid long term. And then of course, pain. We all experience pain, and also like cough and cold. It can be very overwhelming when you go to the pharmacy because they have so many options. So included a little picture of the pain scale there for your reference. So with pain, it's important to note that if the pain is severe, so how we define severe pain is greater than a 7 out of 10 on the pain scale, which again can be kind of subjective, but just know if you're in a lot of pain, again, go seek medical attention. Or if the pain has been lasting more than 10 days with or without treatment, again, go seek some medical attention, go see your provider, because there could be something else going on. So how do we choose a pain medication? Because there are many. So we go to the counter, pharmacy counter, right? We see Advil, we see Motrin, we see Aleve, and this is just one type of medication. Something that I really did want to point out is that you might notice that Advil and Motrin, so Advil and Motrin actually have the same active ingredient. Sometimes people say, oh no, I take Advil and then I take Motrin, or, alternate it, but don't realize, right? It is the same product. Again, some people might say, oh, well, I take Advil sometimes and like also try Aleve. That seems to work a little bit better. Well, Aleve and Advil, again, have like the same type of drug, so we don't want to combine these either. Truthfully, this class of medication, it's got some risks with it. So something we do really worry about is that it can cause a gastrointestinal or a GI bleed if you're taking too much of it for too long. So if you do have to take this type of medication, because it does help with pain and inflammation, which we'll talk about how that's different from Tylenol in just a moment. But if you do have to take it, make sure you take it with food. That'll help decrease the chance of that stomach upset and irritation. But also be monitoring if you notice your stools are turning kind of that like dark tarry color that we talked about earlier, that could be a sign that something bad is happening. Also, if you notice you have kind of a lot of like stomach pain after taking this medication, stop taking it and go see your provider. Another thing with this type of medication is that it can hurt your kidneys. So if you have kidney disease, avoid this if you can. Another thing that also is concerning is if you have any sort of heart disease, you want to avoid this class of medication yet again, because it can cause an increased risk of heart attack and stroke. So is it effective? Yes, but also very dangerous. So again, if you have to take it, make sure you read the product instructions and don't exceed that recommended maximum daily dose. So usually that'll be like 1,200 milligrams of ibuprofen, 6 tablets, since they're usually like 200 milligrams, or just 3 tablets of the naproxen or Aleve if you choose to go that route. So overall, if we can avoid these types of medications, I would say avoid it, just because there is a lot of risk. And we have Tylenol, or acetaminophen is the other name. So Tylenol is very well tolerated for the most part. The only thing to keep in mind with Tylenol is if you have liver disease, or if you consume a lot of alcohol, might not be the best option. So we know that like Aleve and Advil can hurt your kidneys. Well, too much Tylenol can hurt your liver. But again, generally well tolerated. So the big thing is, what's also challenging with these medications is like the cough and cold. They're going to have multiple products. They all say Tylenol, but so we have extra strength, and that's 500 milligrams. We have regular strength, which is 325 milligrams. And then the arthritis pain is 650 milligrams. So, just make sure you pay attention to the product you choose, because we really don't want to have you exceed more than like 3,250 milligrams a day, generally 5 to 10 tablets, depending on the strength. So please, please, please just take into account the product you chose. But I give Tylenol my gold star of approval for pain because, again, generally well tolerated. So that's a good option for you. And of course, there's more. So there are a lot of different topical agents out there, or patches, creams, ointments, lotions for pain. So again, it can be confusing. So make sure you read what's on the product. So this one has like camphor, menthol, and methyl salicylate. This patch down here has lidocaine. This one has capsaicin. So just make sure, again, you're reading the products and finding out what's going to work best for you. Really, these are going to be for like spot treatment of troublesome areas, not really going to help with full body pain or anything like that. But again, like I mentioned, make sure you read those ingredients, because maybe you got a lidocaine patch, and then there was also a cream that you got that had lidocaine too, and then we're kind of doubling up there. So just make sure you read those ingredients, as with all over-the-counter medications. Common side effects you may experience with using these products could be skin irritation, redness, blistering, and itchiness. You are putting it on your skin, so there might be a little bit going on there after you put it on. Just some tips if you do choose to go with one of these, what we call topical products. If it's a cream, gel, or a lotion, we want to make sure you use the thinnest layer possible. In this case, less is more. Slathering it up there is just going to cost you money and not be any more effective for you, okay? So use that thinnest layer possible. Always make sure you wash your hands after applying a patch or a cream or anything like that. I know I just touched my face, right? Sometimes we just touch our face and it happens. And if you don't wash that off, well, touch your face, might burn a little bit. If you get it in your eye, that could be pretty bad. So please just remember to wash your hands after you apply, yes, even the patches, and definitely the creams and ointments, because that might get kind of rubbed in a little bit when you're applying it. And then the final take home, especially if you're going to use a patch, but also, pretty much soon after you apply that ointment or lotion, whatever it may be, do not apply heat or wrap these areas tightly after applying the products, because that can actually cause more of the product to be absorbed and increase the chance of having some sort of reaction throughout your body. So again, they're out there. If they work for you, that's great, but just make sure you keep those principles in mind while you're using it. So that concludes our presentation. What questions do you have for us?
Thank you, Michelle and Steph. You covered a lot, and very good presentation.